Healthcare in the United States has prided itself on scientific objectivity. However, there are many gender biases in the healthcare industry that need to be acknowledged in order to improve patient care. Solely within healthcare workers, there is gender discrimination. In fact, male physicians are more likely to be employed than their female counterparts despite any indication of their work being quote-unquote better. Gender biases and discrimination persists in patient care as well. In fact, a survey conducted in 2019 from Duke Health found that over half of women believed there was gender discrimination in their patient care. This is a lot larger as opposed to 1/3 of men that felt they faced gender discrimination. More concerningly, 1 in 5 women feel that their symptoms were ignored or dismissed. This further proves that there is an issue with gender bias in patient care. This issue is even more intensified for women of color, specifically Black women. Black women are 3 to 4 times more likely to die from pregnancy, and Black women are least likely to be believed when discussing their symptoms. This led me to do more research on reasons on why this was an issue. Black women and women of color are severely underrepresented in clinical trials. For many cancer treatments, despite the fact that Black women are more likely to suffer from cancer. I am very passionate about cancer research due to losing many of my family members to cancer. As an intern at AbbVie Pharmaceuticals, I have read a lot of research papers about cancer research. Something I had noticed was the language of the papers. All the papers only used language within the binary system. For example, man and woman, male and female. I wanted to understand how non-binary and queer-gendered people were affected by the lack of representation in the healthcare industry. I had learned that patient care etiquette was taught through the binary system. This meant that non-binary and queer-gendered people are not taken into account for the most part. This explains why non-cis people are more likely to have negative health outcomes as opposed to cisgendered people. I looked at health outcomes in the transgender community. Due to a lack of understanding, many physicians often push surgery and hormones to transgender people even if they do not want it. This is due to the idea of needing to stay within the binary system of being quote-unquote fully a woman or quote-unquote fully a man. This reminded me of Seba Chowdhury's talk when they went to the doctor and the doctor told them to change their name. Healthcare workers' inability to wrap their head around gender fluidity can be detrimental to the trans community. Gender bias also affects a crucial part of healthcare, mental health. Not only are non-binary and queer-gendered people more likely to develop a mental illness than their cisgendered counterparts, but they are more likely to receive worse healthcare and face stigmatization on their healthcare treatment. Non-binary and queer-gendered people are more likely to be misdiagnosed and therefore mistreated for their mental health. Learning more about gender biases in the healthcare industry allowed me to understand the obstacles many non-binary and queer-gendered people face in order to receive adequate healthcare. The organization National LGBT Health Education Center wants to combat these issues. They are informing healthcare workers and advocating for non-binary people in order for them to receive the healthcare they need. Healthcare workers play an important role in affirming a non-binary person's identity. People deserve proper, caring, and accommodating patient care regardless of their gender identity. Non-binary and queer-gendered people need unique care to accommodate their needs. Non-binary and queer-gendered people face a plethora of health disparities, stigmatization, and discrimination. However, this can be fixed with the proper education of how to treat non-binary and queer-gendered people.